So next speaker will be Dr. Tan from the Philippines. Thank you. She has made a great contribution to enacting the new law against tuberculosis in Philippines.
Thank you very much. Good afternoon. Thank you for inviting me here to speak on the topic, Political Commitment to National TB Program, a Case of the Philippines. I am deeply honored and extremely privileged to participate in this symposium and share my ideas and experience before an audience of my fellow advocates in the fight to end tuberculosis. My talk will revolve around the conceptualization of the anti-TB law in the Philippines, process, as well as challenges in crafting the legislation. I will also touch on the important aspects that I realized through my legislative activities, and finally, about our plans for the next months and years of our continuing quest to end TB epidemic. As a lawmaker and a medical practitioner, I am often asked, why tuberculosis? And my answer is very simple. I have a very personal experience on tuberculosis when I was 9 years old, when my mother got inflicted with TB disease. I personally witnessed her spitting blood. We were poor then, so we have to ask assistance from a family who are well off to support her treatment. During that time, they have to isolate my mother, and I was not able to see her for like a year. So from then on, it's stuck in my head. Just like what I said, we were poor then. So tuberculosis is actually a disease of poverty. And the development or decay of our society will be mirrored by the very action that we put to stop this ancient disease. If I may quote John B. Hoover, an American public health physician, the tubercle bacillus is an index by inversion of the real progress of human race. By it, claim of civilization to dominate human life may fairly be judged. Tuberculosis will decrease with a substantial advance on civilization, and the disease will assuredly increase as civilization retrogrades. Whether or not our present civilization will eventually make a progress or retrogress will be seen in part in our collective effort to stop TB today. As a medical practitioner prior to my foray into politics, I have heard and personally witnessed time and again how so many of our countrymen, many of them are poor, suffer from TB disease. It is as if having tuberculosis is only a natural occurrence for many of my countrymen simply because they are Filipinos. In fact, you will even hear some Filipino doctors telling their patients that it is only natural for them to be infected with TB. And this sad realization was even compounded when I heard Dr. Elmasei Kawamura, former president of North American region of the International Union Against TB and Lung Disease, telling the media, to my extreme embarrassment, that a large proportion of tuberculosis in United States are Asians. Most of them are Filipinos. She further explained that TB is an outcome of poor public health in the country, which I think is true. As a medical doctor and a member of parliament, I told myself that in the face of this sad reality, I cannot just sit down and bury my head in the sand. I have to do something about this in my own little way, so I decided to stick my neck out for a cause that is much larger than myself. Hence, the birth of the anti-tuberculosis bill. Several legislations have been filed in the Philippine Congress since the early part of 2000 in order to address the problem of tuberculosis. However, they were piecemeal legislations and eventually were not approved into law. It was my belief that a more comprehensive strategy is needed to strengthen the fight against tuberculosis. Hence, I have introduced a bill to efficiently implement the necessary controls to arrest the spread of TB disease. I am pleased to inform you that less than 3 years after filing of this measure, it is now a landmark piece of legislation known as Republic Act 10767, or Comprehensive Tuberculosis Elimination Plan Act, which was signed into law on April last year. The Global TB Caucus has already recognized it as one of the most comprehensive global laws on tuberculosis today. The unanimous support of the members of Congress, particularly no opposition whatsoever, and the speed by which the law was passed, merely shows that the strong commitment on the part of our legislators. Generally, the gestation period for crafting the laws in the Philippines is usually 4 to 6 years, and at times even more than a decade or so. So to have a bill passed within 3 years is quite an accomplishment, especially because the bill has to go through a bicameral Congress, the Senate, and the House of Representatives, where a bill has to go back to square one once it reaches the other chamber. The challenge, therefore, it turns out, is not in the crafting but in the implementation of the anti-TB law, as I will try to elaborate in the latter part of my talk. As I have pointed out earlier, the anti-TB legislation was enacted into law on April 2016. Until now, however, almost a year since it was passed into law, we are still awaiting the implementing rules and regulations, or the IRR, that will facilitate the enforcement of the provisions of this legislation, as it is still going through a maze of bureaucracy. Hopefully, though, the IRR will be out before the second quarter of the year is over. But even before its enactment into law, the measure was already presented during the Asia-Pacific Forum of the Global TB Caucus in 2015 in Sydney, Australia, as well as in the Global TB Summit, also in 2015 in Cape Town, South Africa, to be replicated as a model piece of legislation to fight tuberculosis in other countries. At this point, allow me to share with you very briefly a few highlights of our country's successes against tuberculosis disease. According to 2015 Global Tuberculosis Report, the Philippines is one of the 9 high TB burden countries that have attained the MDGs, of decreasing the trend of TB incidence rate and decreasing by half the mortality rate and prevalence rate. This notwithstanding, it remains as one of the top 30 high TB burden countries listed by the World Health Organization. But as of the latest review, case notification is increasing, which is good because at least we can provide cure to TB patients. We are now using new drugs and new regimens such as bedaquiline and the introduction of the 9-month treatment regimen for drug-resistant TB cases. Significantly, a TB law, already considered a flagship legislation against TB in Asia-Pacific region, is now in place. This law seeks to address the persistent problem besetting the current efforts to eradicate tuberculosis in the Philippines. The enactment of Comprehensive TB Elimination Plan Act rides on the wave of the new global strategy that envisions a world free of tuberculosis and expressed as zero deaths, disease, and suffering due to tuberculosis. The law squarely addresses this vision through bolder policies and by harnessing supportive systems to stop TB. It consists of the country's targets and strategies in addressing the disease, prevention, diagnosis, treatment, care and support, and other components of the country's response. Development and application of appropriate technologies to diagnose and treat the disease, strengthening of linkages with local and international organizations for possible partnership in education, advocacy, research and funding assistance, establishment of review and monitoring system to gather data and monitor the progress made in the elimination of tuberculosis, and immediate mobilization of anti-TB services during and after natural and man-made disasters through collaborative efforts of national and local governments and other entities. It escalates the fight against tuberculosis with the use of bolder terms such as comprehensive, and the use of the term eliminate instead of control, consistent with the global strategy which I stated earlier. It evidently reflects the needed change in attitude and action from controlling TB to ending TB and saving lives alone to stopping transmission as well. The law provides for the conduct of researches, demonstration projects, education, and training. The challenge here is to develop and deploy new tools like vaccines, rapid diagnostic tests, drug regimens, or we cannot succeed in ending TB. We need to immediately invest in research and development where there is a huge gap in financing. Essentially, the intent of crafting this legislation is to formalize the existing policies and program into a cohesive piece of legislation with a view of appropriating adequate funds to this massive effort. Against this backdrop, one of the challenges, the critical part, I believe, in the implementation of the anti-TB law is to secure adequate and sustainable funding in the face of continuous unmet funding needs against TB disease. Since the law was just recently been enacted and its implementing rules and regulation is still in the drafting process, the full budgetary effect of the law will only be reflected in 2019, where we expect a significant increase in the anti-TB budget appropriations. Currently, the proposed budget for TB control in the Philippines is 1.3 billion in pesos, or more than 27 million US dollars. It bears stressing, however, that no matter how sound a legislation may be, it is only as good as the people who will give flesh to its existence. There has to be a driving force to materialize the specific and varied provisions of an anti-TB legislation. That force is political commitment. Political commitment is necessary to develop and sustain effective response to ultimately end TB. Hence, in ensuring TB control policy, it is essential that we have to look not just on the boldness and relevance of the provisions of anti-TB legislation, but more importantly, in the explicit, quantifiable, and verifiable commitment of our political leaders. Political commitment against TB can be made manifest both in the pronouncement and actions of powers that be such concrete results are made and not merely lip service. For those few countries which are fortunate to have an existing legislation on tuberculosis, political commitment must be sustained by continuously and regularly updating or revisiting existing policies in light of emerging development in knowledge and best practices, especially in the face of explosion of TB cases due to alarming HIV epidemic, which accelerate the onset of acute MDR-TB and emergence of diseases like diabetes, which further compound the already unfortunate situation. Political commitment is indispensable in ensuring that annual national anti-TB programs are continuously and adequately funded. We need to be able to help the gaps in funding anti-TB activities, specifically in terms of funding priority areas such as expanded diagnosis and effective treatment for drug-susceptible TB, MDR-TB treatment, rapid diagnostics and associated laboratory strengthening, TB-HIV collaborative activities, research and development. It is important, therefore, that members of parliaments must use the full strength of oversight and accountability tools at their disposal. The issue of funding juxtaposed to the objective to scale up and sustain coverage of directly observed treatment short course or TB-DOTS implementation and to ensure provision of quality TB services already creates a substantial financial burden. It is also imperative that proper, adequate, and sustainable budget must be immediately invested in R&D if we are really serious in our fight against tuberculosis. I am convinced that in the face of huge financial resources needed each year to fight tuberculosis, there is a need to bring together members of parliaments and even local legislators, budget executives, finance experts, and funding organizations, the broad pool of anti-TB advocates, to exchange notes and build collaborative efforts in order to bridge the funding gap, especially for the treatment of MDR-TB. I am happy to inform you that as the chairperson of the Committee on Health of the Philippine House of Representatives and as a co-chair of the Asia Pacific TB Caucus and executive committee member of the Global TB Caucus, I have taken it up upon myself to establish the Philippine TB Caucus, which I have successfully launched right in the Philippine Congress just a week before coming here. The caucus will serve as a strategic venue for members of the Philippine Congress to work together across political and geographical divides and promote bolder policies to stop tuberculosis. I would like to believe that the Philippine TB Caucus embodies the future of our fight against tuberculosis, inasmuch as the locus of our fight against TB rests in the realm of budgetary process. It is also significant that the Philippine Coalition Against Tuberculosis, or PhilCat, a public-private mixed model of individuals and organizations committed to fighting TB disease, now sits at the Secretariat of the Philippine TB Caucus and thus serve as a continuity platform in TB elimination amidst the transitory nature of the membership of the Philippine TB Caucus. Moreover, we need to raise awareness for increased investment demands in fighting TB and to help address funding problems. It is estimated that an investment of $1 in TB care yields a return of $30.2 or even as high as $115 for each dollar invested. I believe it will do a lot if we can be a little more active in raising TB concerns in our respective budget, appropriations or finance committees, and putting the administrative agencies and personnel to task to make sure that funds are properly utilized and maximized. We must advocate for lines in the health budget to be earmarked for the provision of TB elimination activities. Mainstreaming the fight against TB in the corridors of powers is a vital step we have to make if we want to end tuberculosis. It is also important to generate and sustain political will, which is essential key if we are to stop TB. Allow me to emphasize that genuine political commitment against TB is more than just the affirmative votes. It is more than just attending TB conventions, as important as they may be. It is more than just declaring, as powerful as it may be, that TB has no place in the future. More than anything else, it is about providing for adequate and appropriate resources for TB care and prevention, and it is in this particular area of concern where we must show up, unite, and flex our muscles. It is also important that we nurture regional and international cooperation. In today's global village, a flat world as others would want to call it, we need to recognize that no matter how prosperous or powerful or advanced a country may be, it cannot contain the spread of TB all by itself. We need inter-country, regional, and international cooperation and assistance, which is the very reason why we are all here today. In the end, we must all realize that there is no easy way to eliminate tuberculosis in our lifetime. But it can be done. It can be done. Together, we can make a difference in the global fight against tuberculosis. Let's do it now. Let's join forces to stop tuberculosis. Thank you and good day.
It's really helpful for parliamentarians who are involved in health policy to hear about your experience of enhancing the Comprehensive TB Elimination Plan Act in the Philippines.